what I find with a lot of women is they have a lot of symptoms that, to me as a gynecologist, are completely indicative of fibroids, but a lot of times their primary care doctor might miss it. And some of those symptoms are things like, why is this person anemic? Why does this person have constipation? Why does this person have pelvic pain? Why does this person have, you know, uh, heaviness in their pelvis? And a lot of these questions can be answered by simply seeing the gynecologist and also by having an ultrasound. So today I'm going to talk to you about fibroids. They're so common, especially in Black women, and it's something that we really need to know as much about as possible. So what are fibroids? Fibroids are smooth muscle tumors. You can go to the next slide. Their fibroids are smooth muscle tumors. Your uterus is actually made out of smooth muscle. And when groups of that smooth muscle organize themselves into this sort of ball-like material, it's called fibroid. And fibroids are made out of smooth muscle, and they basically grow within the uterus in different aspects of the uterus, and we'll talk about that. And they cause various symptoms depending on where they are. Another name for fibroids are uterine fibroids or leiomyomas. Myoma means muscle, and lyo means smooth. So they're smooth muscle tumors. It's made of muscle, fibrous tissue. Fibroids can be different sizes. Some women have them as small as a seed, and they may cause absolutely no problems. But even a fibroid the size of a peanut can cause very heavy bleeding depending on where it is. Some women can have fibroids the size of a melon, like a cantaloupe, or even a watermelon, and they may not have heavy bleeding at all. They may just have pressure. And we can go to the next slide. So how common are fibroids? You see this young African-American woman here, and they're very common in women of reproductive age of all races, but they are especially common in African-American women. Usually we say about 70 to 80% of women will have fibroids at some point in their lives. Most times, if you made it to your 40s and you don't have fibroids, you're probably not going to get them. But if you have them when you're young, they're causing problems. So they're more common in women more common in women in their 30s and their 40s, and they're higher rates in Black women. But anybody can have fibroids, and I've seen very large fibroids in women of all races. Next slide. Can we have the next slide, please? So this is to go back to the previous slide. This is a schematic of what types of fibroids there are. And this looks very dramatic, but it's not dramatic at all. This is exactly what we see in the office. And it looks really scary. But what's even more scary is the symptoms that they cause. And so there's many different types of fibroids here. The first one listed here is intramural, which means within the wall. And those usually cause bulk symptoms. You make your uterus large. Sometimes they can contribute to heavy bleeding. They can contribute to pregnancy loss because of their location. What's more even associated with the bleeding of fibroids is the submucosal, and that means right beneath the mucosal layer in the wall of the uterus. And I can't use my pointer, but I can just tell you that this one down here on the bottom right of this screen is a submucosal fibroid, and it's touching the lining of the endometrium. And the endometrium is that layer of tissue that your menstrual cycle comes from. And anything that's near that layer is going to cause really heavy bleeding. And so if you have a fibroid that is submucosal, even if it's the size of a peanut, sometimes they can cause really heavy bleeding. They can cause spotting. But a lot of times, they're just there to cause bleeding. They're subserosal, which is right under the thin uh, covering of the uterus. And a lot of times those cause bulk symptoms, or they make your uterus big. Sometimes you can feel them through your abdomen, depending on how big they are. There is pedunculated, and that means on a stalk. Those are the type that at the top of this diagram you see, it's literally growing on a stalk. And I had a patient recently, she had a stalk about as big as your thumb. The uterus was almost a normal size, but the size of the fibroid was, I would say, approximately the size of a leg of a lamb, like half of a leg of lamb. It was literally this tiny little stalk with this huge fibroid growing up under her diaphragm. So it was shaped like a football. That literally was the size of it. And it caused tremendous discomfort in her abdomen, a lot of constipation, a lot of pressure. She looked like she was pregnant. And then after surgery, of course, she did fantastically. And she was so happy that she did that. Now, another type of fibroid that is, we see a lot of that, and I'm going to use a lot of very colloquial, familiar language. It's just crazy. This one here in the middle of her cavity, that one is like if you open up an avocado and you see the pit in the middle, some fibroids are sitting in the middle of the cavity like that. And they grow unrestricted because there's nothing to stop them. And every time women have their cycle, they feel like they're giving birth to a baby because literally their uterus is squeezing around this fibroid. And sometimes what I've even seen is intense pain that women have, a watery, I call it a beer colored fluid that comes out of their uterus. You know, they're wearing panty liners all the time. They have no idea why they have this discharge. And what we end up finding is a fibroid in the cavity of the uterus like that. And they can get so big and your uterus can get so strong contracting around it that I have actually seen women deliver those through their cervix when I'm trying to do a pap smear. It'll just come out like a big gumball and sit there, and they can bleed tremendously from those. So fibroids are just, they vary in their size, they vary in their location, they vary in the type of symptoms that they can cause based on where they are. And they just wreak havoc, and they just cause a lot of problems for a lot of women because of the fact that they're just so common. And the thing that makes them grow is the fact that we are women and we have estrogen and hormones. And so as long as we have estrogen, they just keep growing. You can go to the next slide. So what causes fibroids? We know that fibroids do have some element of component where the person who has fibroids may have them because their mother had fibroids, or their grandmother had fibroids, or their sisters had fibroids. So there is some kind of genetic component. And there is a genetic component that they're doing research on that allows us to know that there's some mutation that causes some fibroids to get larger than others. Some women may get one fibroid that's just huge. Some women may get like almost like a whole farm of fibroids, and you go and you try to take all the fibroids out, and there's always like a couple of little sesame seed fibroids or a peanut fibroid that you can't see. And within several years, the fibroids return because you simply cannot get rid of all of them. And that's a really common kind of presentation that I see in women who have them removed. A lot of times, depending on the kind of genetics they have or the kind of fibroids they have, they can grow back, and they can grow back very aggressively. Fibroids are definitely linked to hormones, and they're linked to the hormone estrogen, which we all make while we're premenopausal, before our periods stop. We have plenty of estrogen circulating around, and because we have that, the fibroids are sensitive to it, and the fibroids continue to grow. Usually in menopause, when your estrogen decreases, your fibroid will stop growing. Sometimes they will shrink, and sometimes they will degenerate, or to use a better term, they will kind of rot inside the middle of them because the blood supply is cut off. the fibroid will stop growing, and they become sort of necrotic in the middle. And sometimes that causes like an aching or a pain that some women experience towards menopause. And that's also a reason why, even though they're in menopause and you would love just to leave the fibroids alone, they may need to be removed because the woman will have pain from the fibroids. Certain lifestyle factors can cause fibroids to grow. Women who eat a lot of meat products, because they put a lot of hormones in our meats. The meat itself has compounds in it that we're not really sure how they affect fibroids, but we know that women who have a high fat, high red meat diet are more likely to have fibroids, and they also can potentiate the ability of the fibroids to grow. Women who are obese may also have more likely to have fibroids or have fibroids grow, because in our fatty tissue, we also make estrogen, which also makes the fibroids grow. So they're going to grow during the childbearing years, and they're going to shrink when we get into menopause. And our next slide. So common symptoms of fibroids are heavy periods. Now, I always tell women the average amount of menstrual cycle you should lose per menstrual cycle is probably 2 or 3 tablespoons. And people think that that's crazy, because I can tell you most of us do not bleed that little. So if your period is, you're using a tampon and a pad and you're soaking the pad, that is not normal. If you are passing clots the size of a walnut or larger, that is not normal. If you sneeze and a big clot comes out, that's not normal. If you're soaking your pants, or you're ruining your pants or your seat at work or in your car, that's a lot of bleeding, and that's not normal. And I think sometimes what I find with patients is, instead of saying, "Are your periods heavy?" and they say, "No, not really." Or maybe the first day is, when I question them how much blood they're losing or how many pads they're using, often times I get a real assessment of how much bleeding they're having. And, and, and any of those symptoms where they're
Dr. Freeman, I think your audio is going out.
you're changing, or if you're lasting 5, 7, 9 days, you know, is larger. She said my audio is choppy,
Yes.
so I'm sorry for
Yes,
that.
it is. It is breaking up here.
But I'm glad I have these slides. You can read what I'm saying, and then hopefully we get into questions. You can ask your own questions. And we can get to the next slide.
Okay.
So when there are no symptoms, many women don't have any symptoms at all. They don't even know what's in there. And sometimes they don't know what symptoms to look for. So they'll go to their primary care doctor, and they're noted to have anemia. And until someone asks certain questions, they would not even know that they had fibroids. But those are kind of questions that gynecologists ask, because we're mainly interested in how much bleeding people are having, or if they're having pain with sex, or fullness in their pelvis. sometimes you have fibroids. They don't all require treatment. Sometimes they're just there. You truly may not be having any symptoms, and you may not have any heavy bleeding or anemia, and there may not be any reason to do anything with them. But we often find them during routine exams. And one thing that I was trained to do that unfortunately I would say some doctors do not do, and I'm not sure what that's about, is we do what's called a bimanual exam, where we may put one hand on top of your abdomen and with two fingers in the vagina to press your cervix, and we're pushing your cervix up and pushing your uterus between our hands to get an idea of how big your uterus is, to feel your ovaries if we can, to see if we feel any kind of masses in the pelvis. And that is very important, I feel, for every doctor to do that's doing GYN exams, because we want to make sure we can feel the size and shape of the uterus to the best of our ability, especially if she's having symptoms. Next slide. So how do they affect your daily life? You can just be tired. You can just be very tired. You don't know why you're tired. And many times you're tired, but you don't really associate it with the fact that your period is very, very heavy. And so sometimes we may check your thyroid, we may check your blood count, and sometimes we check your blood count and find out that you're anemic, which leads us to check for fibroids, because with young women, that really is the only reason why you should be anemic, unless you have some kind of blood disorder like beta or alpha thalassemia, maybe sickle cell trait. Women should really be able to replenish the amount of blood they have every month with the foods that they eat and the nutrition that they take in. But being anemic is a sign that you're probably losing more than your body is making. You may miss work or activities because your period is so heavy that it's hard for you to go to work and sit in a chair. It causes emotional stress because every time your period comes on, you feel pain, you feel bloating, you know your period is going to be heavy, you know you have to take pads wherever you go, you know there's probably going to be an accident no matter how much you do, and you plan your whole life around when is this 7 days a month going to come. And it's very, very distressing for some people, and it's really not a way to live your life. And it affects relationships and intimacy, because if you're having maybe pain before your cycle and then you're having 7 to 8 days of a cycle, it's very difficult to know when you can have sex because you feel like you're always preparing for the cycle that's coming. Next slide. Fibroids can sometimes make it hard for you to get pregnant, especially when
I think we've lost you again, Dr. Freeman.
mucosal types, which in fibroid, there may not be adequate blood supply to nourish the pregnancy, and that can be a reason.
One moment, I see that she's trying to connect her audio. Oh, you just muted yourself.
Can you hear me now?
Yeah. Say something else.
You can hear me?
Yes.
Okay. My computer may pick up and then I'll have to turn this one off again. I'm so sorry.
All good.
is depending on the location of fibroids.
Okay, yeah. The computer just picked back up.
Restrict the growth of the baby. So those are things to consider. I also consider the age of the patient because some patients come in and you can be in a very precarious age. For instance, you're 38 or 39, and you're trying to have your first baby. You really have to weigh a lot of different considerations before you decide to remove fibroids or not to remove fibroids. And so that's why it's really important to have these things diagnosed early so that you can prepare for childbirth, or if you desire to have children, to prepare for that before it becomes your advanced maternal age. We have a next slide. Can we have a next slide? Okay, good. So how do we diagnose fibroids? These are beautiful slides, I guess, from a doctor's standpoint. So we talked about the pelvic exam where we're putting our hands together and can you see me now?
Yeah.
Because I can see myself.
Yeah.
Okay, good. So I won't do anything crazy. So we're putting our hands together where we're trying to feel the size of the uterus. But most times we can look and see the uterus with an ultrasound. This first picture is a side angle. It looks like a pork chop with the right side being the bone, but that's the cervix. And then the top of it, the round part, is the top of the uterus. And at the bottom of the first picture, you see a little round ball. And that little round ball is the fibroid. Yeah, at the top of the first picture. At the bottom of the first picture. So that round ball is the fibroid. And so most times we can see fibroids with an ultrasound. And sometimes I may do what's called a saline ultrasound, where I put fluid within the cavity of the cervix and it goes into the cavity of the uterus. And if there's anything in there like a fibroid or a polyp, you can see it visibly. And it's easier to know if something is actually in the cavity by doing those types of sonograms. But MRI is another test that we use. It's a little bit expensive, but MRI is very important when a woman is having just the fibroids removed, because you have to know where they are, how much uterine tissue is there to put back together, and which fibroids are most likely to cause. Sometimes you go in, you may not be able to take all of them out without leaving the uterus in a condition that is not able to be useful for childbearing. So this patient has fibroids. You can see them 1, 2, 3 in the front, and you can see her. I'm saying things like y'all, but hopefully you'll know this. This behind it is her backbone, and you can see why some people have pressure in their rectum or pressure in their back with fibroids, because they're sitting there and they are affecting nerves in that area and causing a lot of discomfort. But most of these tests are pretty simple. They're not that invasive, and they give us a lot of information, and they're very necessary. All right, the next slide. So how do we treat fibroids? Depending on the patient's symptoms, if she's not having any symptoms, we can watch and we can wait, and we can maybe do an ultrasound every year and see if they're growing or if they're causing any problems. But depending on what she desires or what her plans are, they don't necessarily have to be removed surgically, or we may not have to do anything else with them. There are some medications that help control the symptoms, like birth control pills, a progesterone, a hormone secreting intrauterine device, or an IUD. Those things can be very helpful. They say non-surgical procedures. One would be the uterine fibroid embolization, and that's usually done by a radiologist. The fibroid embolization allows the radiologist who specialized in that to find the veins that are feeding the fibroid, and they go through your leg vein, and they put these little, for lack of a better term, little pellets in those blood vessels that feed the uterine fibroids, and that causes them to shrink and to die. That procedure is useful for women who don't want any surgery, who may be high risk for surgery, who maybe have fibroids in a certain location that are easy to deal with in this manner, or patients who are just losing a lot of blood, but they can't have surgery immediately. So we try to do something like this, a heavy bleeding before they have surgery. Myomectomy and hysterectomy means removing the fibroid in there. That is the Sonata procedure that I do, and it is transcervical, meaning we go through the cervix into the uterus with an ultrasound probe that's about as big as my thumb. It finds the fibroids in the wall of the uterus, and if you can see, it puts these little metal spokes into the fibroid, and they get hot, and that helps destroy the blood supply to the fibroid, and that helps shrink the fibroid for up to 50%, and it reduces the bleeding over the course of the next year tremendously for some women. And so some women opt for that. And that's also a procedure that we can do if, for instance, you're 28, 29, or you haven't met the man of your dreams, and you have a fibroid in the wall of your uterus, and you don't want it to grow, but you don't really want surgery. So by doing that, we can help stop some of the growth of the fibroid. Okay, and the next slide. So the key takeaways are, fibroids are common. They're usually not dangerous. I've been in practice for 24 years plus 4 years of residency. So that's 28 years, which is crazy. But I've only seen cancer in a fibroid, and not even in someone that I've operated in 3 times. And so that's how tremendously infrequent it is that you will ever have cancer involved in a fibroid. And some people want them out because they think they're going to be cancerous, but most of the time they are not. And that you can have many different symptoms from fibroids. There's many different treatments depending on your symptom and what you're trying to accomplish. It's not always necessary to have a hysterectomy. And whatever you need to do, you can talk to your doctor about what treatment is right for you based on the symptoms that you're having, the size of your fibroids, and the different types of outcomes that you're looking for. Next slide. So this is a good time for a question and discussion. That's myself and one of my colleagues. That's Brenda Lieberman. She's actually a doctor of nurse practitioner, so we call her Dr. Brenda. She is a fabulous member of our team. And a lot of times if you call the office, you'll see Brenda first, and she gets all of your information. And then if you need a follow-up ultrasound, she sends you to have an ultrasound with the ultrasound tech, in which case you'll have an appointment with me, and then we kind of discuss the options. So she's a great way to get into the practice and get some of your questions answered and your symptoms discussed, and get on the schedule to have some diagnostics done. So we kind of work as a team, and I just wanted to introduce you to Brenda. We're also on Instagram at Arboretum Gyne, and we're on Facebook, Arboretum Gynecology. In case you would love to follow us, we'd love to have you following us, because I also try to give good information there as well. And a lot of times it comes from the questions that the patients ask. So thanks for listening, and I would love to entertain any questions that you might have.
Thank you, Dr. Kawaku. I do have one question for you. Um, what
Mhm.
usually happens if the fibroids get so big while you're pregnant? Does that affect the baby, or how does that work as far as just waiting till they deliver
It depends
and
on,
then removing the
yeah,
fibroid?
it depends on where they are. It depends on where they are and what kind of influence they have. Obviously, if it is in the wall of the uterus, a lot of times, sometimes the baby and the fibroid will compete for blood supply, and the fibroids will actually shrink, which is great. Sometimes the fibroids can grow, and sometimes the fibroid is just there and it's large. They cause very different symptoms depending on where they are, how big they are, and um, yeah, they can cause the baby to not be able to turn properly. So during before labor, instead of being head down, the baby may stay breech or sideways, which is very scary. Because then she'd have to have a C-section. And fibroids are famous for having a lot of bleeding. So if you have to do a C-section on someone who has fibroids, and she has fibroids in the way where we're going to make an incision, sometimes we have to even become inventive about how we're getting the baby out. And we've done, in my practice, when I did deliveries in my practice, we'd have all kinds of ingenious ways. Instead of having a C-section down low, you'd have it on low on your belly, but you might have a midline incision on your uterus, or even start with a low incision and end up with something like a T, because that's the only way we could get the baby out. And it's a little scary for everybody. And that's why oftentimes, like I said, we want to try to deal with this before we get to that point, because um, it can make pregnancy very difficult. It can make delivery very difficult. It can be a cause of women who hemorrhage after delivery. Um, so that's what they can do. And they can also affect, the growth of the baby. Sometimes they compete for the blood supply. The baby may not get an adequate blood supply, and the baby may, not grow properly. But like I said, most times they don't cause a lot of problems at all. And I've had a lot of patients who've had babies with fibroids, and they've done great. I've had a lot of patients who've had fibroid surgery before pregnancy, and they've done great. They usually have to have a C-section. But then I've had some patients who've had fibroids, and they may have complications, but they still done well. So, it all depends on a lot of different factors.
Okay. And are there any other lifestyle recommendation changes that we could do as women to prevent uh, fibroids growing within the uterus?
They respond to estrogen. They respond to foods that we eat. So I would just say, just like with everything, try to maintain a healthy body weight. Try to not have a diet excessive in fatty foods, red meats, processed foods. Those are really the main things. Fibroids, birth control pills and things don't make fibroids grow. That's kind of a myth, even though they do have estrogen and progesterone in it. They have just enough to prevent ovulation, but not to really, feed fibroids. But, a lot of things, especially in our community, can be solved by maintaining our healthy body weight and not eating a lot of foods that are fatty and processed.
Okay. All right. Do we have any questions from the group at this time?
I saw we had a raised hand. Oh, there we go. Did you? Yeah.
Oh, I have a quick question. Can you hear me?
Yes.
Yes.
So, a question. I know you said that they can dissolve, I guess, or shrink, I guess, through maybe like estrogen levels. Once that gets lower, how long will that take? I guess, like when you go through menopause or perimenopause, is there a exact number or time frame?
There's not an exact number, and I'm glad you mentioned the idea of perimenopause, because when I talk about menopause or perimenopause, perimenopause is a time like right before your periods are about to stop. And unfortunately, that is a time when a lot of your hormones are just going haywire. I mean, normally your estrogen should be doing this, and instead in perimenopause, it's just kind of like going everywhere. And when you have spikes in your estrogen like that, it affects your lining of the uterus. So women often have very heavy cycles. And because the fibroids are sensitive to the estrogen, they also will be activated more. So women sometimes have more bleeding when it's time for their periods to start slowing down and becoming less frequent. But when menopause comes and your period just stops, your estrogen is slowly going down. And so each fibroid is becoming individually less reactive to the estrogen because the estrogen is falling. So, I don't know if they've done any studies on this because every single woman is different and every single um, transition to menopause is different. But it's highly likely that once you get to 3 or 4 or 5 months with your estrogen declining, they at least stop becoming activated, so to speak. And then as your estrogen decreases, they stop growing. But I don't know how long it takes. So I don't think anyone knows how long it takes for, say, an 8 centimeter fibroid to go to a 5 centimeter fibroid, because they don't just become like this and they go like, teeny. They go from like, bigger to maybe shrinking down by 50, 60%.
Okay, thank you.
Mhm.
We have a couple more questions in the chat, Dr. Kwaku. The next question is, what impact does HRT have on fibroids?
It really doesn't have much. But what I will say is, you're giving back a small HRT is actually a lot less hormone than even a birth control pill. And a birth control pill is a lot less hormone than what you're making naturally. And what you make in pregnancy is a lot more than you do with any other hormonal ingestion. So that just puts it in perspective that pregnancy, there's tons of estrogen, and that's why they can also become activated. HRT will not usually it's not thought to cause fibroids to grow. But what we do know is that you're giving a fibroid, especially if it's in a sensitive location, like right under the lining of the uterus, you're giving it just a little bit of juice. And what I often see in women who have postmenopausal bleeding that are on hormones is that the estrogen has activated the fibroid just enough to cause a little spotting. But that's why we always try to balance the estrogen that they're taking with the progesterone tablet or the form of progesterone that they're taking, because it balances it and keeps those things balanced so you don't have the bleeding. And most times, if I have women that have bleeding after menopause, very commonly, I do this every week. We'll do a little study where we'll put a little camera inside of the cervix and look in the uterus with some fluid. We'll see if we see anything that's grossly causing the bleeding. If all I see is a fibroid, we do a few biopsies to make sure everything is completely negative and there's no sign of cancer or abnormal cells. And then we just put them back on their hormones and tell them that, a little while for their body to adjust to that balance of the two hormones. And I can say this to a group of women here, and I hope I don't offend anybody that owns a med spa, but this is exactly why board certified OBGYNs do not care for the distribution of hormones by people who are not OBGYNs. And especially hormones like pellets, which are not FDA approved, and other forms, people calling and speaking with people on the phone and this is not a vitamin. This is not Tic Tac. And this is not something that you can just get from anybody who took a course on how to give hormone replacement therapy, you will feel great. And you will tell all your friends that you feel great, and all your friends will tell you they feel great. But hormones can cause cancer, and not necessarily, I don't worry about breast cancer. We don't worry about breast cancer so much. We worry about cancer of the uterus, because you have to have a good balance between the estrogen and the progesterone. And so if I say this to no other group, please, Black women, do not go to the corner shop or call the people on the phone to give you hormones, because your doctor is qualified to do that. And if you have a doctor who does not feel comfortable giving hormones, and some of them do not, come to me. I will give you hormones if you're a good candidate, because they do make you feel better. But you have to be managed what to do if you start having any kind of problems.
Okay, we have two more questions. And our next question is it possible to have fibroids after a hysterectomy?
Yes. Here's the thing. And I had someone that had this very recently, where we had done a hysterectomy, and there must have been a baby seed fibroid, because fibroids, they can metastasize. They can get their blood supply from other sources. And I talked about the one who had, the patient who had the one like a football, hers was growing from a stalk from her uterus. And once we found the little stalk, we were like, oh, this is going to be easy. We're just going to take it out in little pieces through our tiny little women surgeon incision, and this is going to be great. And when we got to the top of it, it was actually stuck to blood vessels that were coming from her stomach, and it became very complicated. And we called in a surgeon, and we were able to take care of it. You know, she didn't have any complications in the surgery. But fibroids can be interesting. They can be very, very interesting. And I also had someone recently that I had done a hysterectomy on. And when I went into the field, because we're feeling ovaries even after you don't have a uterus, I felt a mass. And I was like, it felt like a hard mass, like a fibroid. And when I sent her for an ultrasound, she had a fibroid in there. It was about the size of an apple. And evidently, she must have had one that was very tiny, that maybe we couldn't see, that had gone, to the side. And it just continued to grow, because she was still in premenopausal. She still had her ovaries, and she was still making estrogen. And I honestly, that is the first time in 24 years that I have seen that. But it is possible, because fibroids can attach to other things: bladder, bowel, blood vessels. They can go through your bloodstream to land on other organs. I mean, that's really rare, but they can do a lot of different things.
All right. We do have one more question. Even though we're focusing on fibroids today, what about cysts? Are the symptoms the same?
Cysts on your ovaries are something that women who are of reproductive age should have every month. And I think there's this misnomer where people say, they said I had a cyst and something's wrong. I always say, remember health class when you were in 8th grade and they talked about ovulation. Well, every month your hormones do this little cycle thing. And while they're doing that, they're causing your ovary to produce a little egg and to mature. And part of the maturation of that egg is a little fluid around the egg, which helps create lubrication. So once it gets ovulated out, there's a little bit of fluid to send it on its juicy way. Okay. So you have this fluid in your pelvis, and this egg is just floating in the pelvis, in the fluid. And then the sperm go through the cervix into the uterus, through the fallopian tubes, to find the egg that's floating in the fluid. So it's a whole system that God has created to make your body work the way it works. So every month you make a cyst, and it's normal. Sometimes if your hormones are out of sync, or if you're going to ovulate, but for whatever reason you don't ovulate, or maybe you make a cyst and you ovulate, but it doesn't rupture the cyst, that cyst can continue to grow. And sometimes when the cyst continues to grow, it can also be producing progesterone and hormones, and that cause you to have irregular cycles or heavy bleeding, or no period at all for significant periods of time. And so they can cause irregular periods, pain, heavy bleeding, but usually that pain and heavy bleeding is short term. It's something that you have this month, but maybe you won't have next month. But the symptoms that you have from fibroids usually comes every single month. You have heavy bleeding all the time. You have pain all the time. You have pain with sex all the time, depending on where your fibroid is and what it's causing. So cysts usually cause a different type of discomfort, but a natural discomfort they cause is called Mittelschmerz, and that is the pain that comes with ovulation every month. Some women feel it, some women do not. But if you keep track of when it's happening, you may notice every month, about 2 weeks after my period starts, I feel like this little pain in my pelvis. I sit still for a day or so and try not to do too much moving, and I take some ibuprofen and it goes away. That's normal. But if it becomes more painful than that or more constant, that's something that you need to bring to our attention so we can do an ultrasound and have a look.
All right, thank you. If there are no more questions, I'm going to go pass it over to our president of the Concord Alumni Chapter, Sora Bridget Herring Williams.
Great evening, everyone. Great evening. Dr. Freeman Kawaku, thank you so very much. We extend our sincere appreciation for you leading this informative fibroid education session to help us to kick off our May Week observance. Your expertise, compassion, and commitment to women's health has always provided us with valuable insight in how to better understand and advocate for our well-being. I know that I have certainly learned a lot this evening. Thank you for helping us to begin this week with purpose, awareness, and care. Thank you to each of you for being here, and we hope that you will continue to join us throughout our 2026 May Week.
Thank you for that. One more thing. I wanted to share that we do have a few events this week that everyone is welcome to come to. We have our Mind, Body, and Soul Walk, which is on Wednesday at Harrisburg Park. And then as well, while we're there, we're going to, take a breather, get our mental health together because it is Mental Health Awareness Month. But we also have a few initiatives this week that we're really working hard to do. We have Cuddles for Courage, which is in collaboration with the St. Jude's Affiliate Clinic here in Charlotte. We're donating newly purchased stuffed animals. So if you're coming to the walk, definitely bring a stuffed animal with you. And we're partnering with the Department of Social Services in Cabarrus County, where we're focusing on foster care, which is National Foster Care Month as well. So we're asking that everyone brings a duffel bag so we can help those children that are in need. I'm going to pass it over to my co-chair, which is Portia McDuffie, and she will do the closing. Thank you.
Thank you.
I want to thank you, Dr. Freeman, for sharing your valuable insight on fibroids. Your time and your knowledge made this conversation truly meaningful. We appreciate you and we thank you for being a part of our May Week program.